Thank you, Wendy, and thank you all. I think I'm really blown away by the diversity and the depth of knowledge and experience from all the panelists. And so I know we are running short on time, so I'm not going to ask my own questions, even though I have about 1 million of them. And instead, I want to really engage you guys, because I'm sure that there's a lot of questions from all of the great material that's been shared with you this morning. So I will open it up to questions from our audience, and hopefully we'll have a little bit of time for some discussion. Yes, sir.
Hi. I'm in a coma from all of the great ideas that you have offered this morning. Thank you very much for each person, very innovative. I'm Steve Sunderland from the Peace Village Cancer Project in Cincinnati, Ohio. And the more I listened to you, the more excited I was about many of the things that you said. And then I realized we're really living in two worlds. I mean, the world that you're talking about and then the world that I live in, which is dominated by cancer. It would be a different panel if everybody on the panel had cancer. It would be a different panel if everybody on the panel was in a wheelchair. It would be a different panel if everybody on the panel was a representative of a black church in an inner city. Those worlds just don't interact with the worlds that you're talking about as I see it. And I'm sure I'm being unfair. I'm sure I'm generalizing in a way. But to make that point, we live in very different worlds where information about our world is really not known, and how we interact with the health system so that we can reduce the unbelievable mortality of low-income people and minorities in our cities is something that is just devastating. But even when the information is known, how many people die every year, it doesn't seem to realize itself in action. That's why we're in two different worlds. Yes, there can be a tremendous reduction in malaria somewhere in the world. Fabulous. Care packages can go, or care programs can go. That's fabulous. But the mortality in my city is unbearable. And the impact on people who are disabled, who have cancer, is unspeakable. And so while we talk about shared values, I think we need to somehow acknowledge the different worlds that we're in. And that maybe you hold out hope that we can be in one world. That's certainly what entrepreneurs could do. I think you really hit strongly on that. I agree with that. But as of right now, we're burying our citizens. And I think we need to change that. Thank you.
Thank you. Yeah, sure. Go ahead.
So thank you very much. I think one of the interesting things that came out from Dr. Zhao's talk this morning was that there are a lot of learnings. And so I work primarily in sub-Saharan Africa, and the population we work with, make less than, on average, $2, $3 a day. And trying to develop solutions in those settings, I think there's a lot of opportunity to take learnings from those type of markets to bring them back to quote-unquote developed markets. And there are, information I think is a really good example. So when I have been in different meetings showing people what we do, one of the very first reactions always is, we have massive issues with access to healthcare in the US. We have whole populations that actually have worse HIV outcomes than we have in many of the African countries that we're working in. And there is no way for government, for NGOs, for private sector providers to have a way of seeing exactly what's going on and help them shape their direction. And so I am hopeful that we can learn a lot, and we call this south to north. I would be very proud if we can get south to north transfer of ideas and technologies to address that, because I do think that while we are in very different worlds, we all exist for the same purpose, which is hopefully to make the world a better place and to help those who need it. So my hope is that we can have more tech transfer and make a difference.
Thank you, John. Sam?
Hi, this is directed, Ben Hoffman from GE. This is directed at John. I really enjoyed hearing your story. I have a similar story 20 years earlier, but unlike you, I went to the dark side. I work for industry, okay? It seems to be getting a little less dark, shared values now, frankly. You mentioned information technology, and I've come to believe in the last year or two that digital transformation that's out there, its ability to apply both in the form of information technology and other sorts of digital connections, has an enormous potential impact to improve the health of the developing world and our world here. That said, it's something I'm trying to encourage the Academy of Sciences here, the medicine group, to start to approach this, because I think maybe we can jump over hurdles that, if you use, let's call it analog for lack of a better term, ways to solve problems which for the most part, net have not been all that successful, and there's plenty of successes. Mm-hmm. Have you actually evaluated this? Do you have a blueprint on this? Because there's really very few groups that I'm aware of that actually have looked at this in any sort of methodical way.
Yeah. We haven't personally, but I think what Dr. Zhao was referring to this morning, that's actually a very interesting study. I think the World Economic Forum through the Schwab Foundation has some very interesting analysis. A lot of impact investors have actually published white papers sort of describing the landscape and the innovation that's happening. I'd say from our own personal perspective, we're a small entrepreneurial company. We didn't have the resources to do that sort of thinking. So we made the decision to take the direction we took based on our own personal experiences and what we felt from working for a decade on the ground, what we thought was necessary. But I think the really interesting thing that could come from your idea is that, I really do believe there's a lot more that can happen with direct interactions between entrepreneurs and multinationals and impact investors and donors to maybe encourage more ways of discussing this and identifying and help encourage entrepreneurs to go seek solutions in areas that we haven't solved yet. But I think the beauty of working in these markets is there's a great opportunity for leapfrogging, massive opportunity for leapfrogging and rethinking how healthcare is delivered. I think that's the really exciting part.
Thank you. Other questions from our audience? All right. Do we have time, or should we wrap up? Okay. All right. So I will we'll hopefully get the chance to talk to all of you after this panel and in the future. So I won't take up more of your time, but wanted to thank all of our panelists, and please join me in thanking Wendy, Marjorie, John, Abby, and Aaron. I'll turn it back over to you, Brenda.
Thanks very much for that. That panel was so robust. I mean, there's so much going on there. I think we could spend the next 3 hours talking with all of you, and I'm sorry we don't have the time to do that. We are going to take a very short break, 10 minutes. We're going to reconvene at 11:35. We're running behind, but we have some tricks up our sleeve to get us back on track. So if you can all please try to get back in your seats by 11:35. I'm looking at Rachel. Does that make sense? Okay. Thank you.
Thank you very much.